I'll be your student nurse today. Can I get your name and date of birth?
Allison Stelber, 4982.
All right. So I'm going to be doing a respiratory assessment on you today. So all I really need from you, if you're fine with it, I'll just have you lower your gown when I need to listen to your chest. So upon talking to my patient and entering the room, I'm already observing her. I'm looking for how she's breathing, if she's having any difficulty breathing, using accessory muscles, and the symmetry of her breathing. And then I want to ask about respiratory history. So I'll ask if she's had any COPD, asthma, lung cancer, tuberculosis, pneumonia, bronchitis. And then I will ask about occupations, because concerns would be like hairdresser, nail tech, farmers, factory workers. There's a lot of things that they can breathe in that can affect the lungs. And then I will have them walk me through a day in their diet, because it's kind of, when they tell you what they eat, it's a little easier to tell whether it's good or not. Sometimes healthy versus unhealthy can be kind of subjective. And then I want to know what type of exercise they do, if they do any exercise, or if they have any difficulty breathing on exertion at all. So then I'm observing, which I did. And so then I can percuss. So what you do when you percuss, you want to make sure you're in between the ribs and the intercostal space so that you can hear the right sound. Because if you go on the bone, it'll be dull. So you can kind of find the, like, where the lungs are. So resonance would be the normal sound that you would find. And then hyperresonance would be the overinflation of the lungs. So it could be from COPD or chronic asthma. If you hear a dullness, it could be from fluid. And then if you hear something like a flat sound, it could be from a tumor. So then I'm going to palpate first. So I'm just feeling for symmetry. I'm looking for tenderness anywhere. And then I'll have you turn this way. So again, palpating for any tenderness. And then I'm going to check the excursion. So I'm going to put my thumbs together here about the 10th intercostal space. I'll have you take a deep breath in. And I want to watch my thumbs. You want them to be 1 to 2 centimeters apart on that inhalation. So then I'm going to check tactile frematus. So I'll have you say 99.
99. 99. 99. 99.
So what I'm feeling is that vibration when she's talking. So if I feel that vibration, that's a good thing, because that means there's air in the lungs. And then I'm going to auscultate. So what I'm looking for, bronchial sounds, I would hear them in the trachea. They would be high-pitched, hollow, short inhalation, and a long exhalation. Bronchiovesicular sounds will be medium-pitched, and the inhalation and exhalation will be equal. And then vesicular sounds heard throughout the outer part of the lungs will be a lower pitch, long inhalation, short exhalation. So then I would start up at the collarbone, and then every time you feel my stethoscope, you can take a big deep breath in through your mouth and out through your mouth. And I want to make sure I listen for that full breath in each spot. But for demonstration purposes, I'm not going to make her heavy breathe that much. So then but I want to go on both sides, because you want to check that symmetry. So then I go to the second intercostal space, and then over, and then I move down and over, down and over. And then for a female, I would ask them to lift their breast tissue, and I would be doing this under their gown. And then here and there, and I'll have you turn. And I'll do the same here. So I'll start up here, full inhale, full exhale, this side, down, over, down, over. And then here. And then I'll have, so there's 2 lobes in the left lung and 3 in the right. So I'd have her lift her arm and I would kind of listen in this manner, again, for the full inhalation and the full exhalation. So different adventitious sounds that I'm listening for would be crackles, and that sounds like rustling of leaves, usually in the lower lobes, and that is from fluid in the lungs. Ronchi is it's like a continuous snoring sound. Wheezing is a high-pitched sound from asthma or allergies or anaphylaxis. And there's stridor, which is a really high-pitched sound, and that's from the narrowing of the airway. And then you have diminished breath sounds or absent breath sounds, and that would probably mean that someone needs a chest tube. Something super wrong. And then you would listen and have the patient posteriorly, you would listen and have them say E, 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 E. And what you're listening for, you want it to sound like E. If it turns to A, that is egophony.